All right. All right. Oh, welcome everyone to today's online facilitation. I hope you can all hear me. I must say thank you so much. I apologize for the 5 minutes lateness. I didn't get to on the system on time. Yeah, this is our first meeting. Let me also apologize for not being able to meet up with last week. The facilitation actually started last week, yes, but I couldn't manage to come online, but I'm hoping to make up with you. I hope that we'll be able to have a scheduled meeting outside the normal weekly Thursdays that we'll be having for the next 8 weeks. Um, as I've introduced myself uh, on the school page, my name is Dr. Latif Adepeju. I will be facilitating you for the next 8 weeks. Yeah. So I'm seeing Titus Peter, I'm seeing the Naomi. Thank you so much out of your busy schedule to have joined this online class. Yeah, that's just the introduction. Please kindly mute. I think that should be Afa. Please kindly mute yourself so that there won't be interaction with our class. How many of us are able to access the instructional video, PowerPoint video that I sent, I think, earlier today? If you are able to do that, you can signify by raising your electronic end. So every week, at least a day to our meeting, I will be posting PowerPoint instructional video on what we will cover, which explains better the topic that we have that is in your course materials. The essence is to assist learners to have different medium to comprehend the lesson or the topics or the units that has been given to them to cover for the semester. And I also want to say that it is very important that learner understand the importance of consistency in attending class. There are things that are not covered, even in the instructional video, that it will, maybe one of the students will just ask in class and it will be explained. But if you are not in class, you will see that it will be, you won't be able to get that explanation. So I'm encouraging everyone to kindly and please attend our weekly online 1 hour facilitation. So don't forget, this is a student-centered learning. And as a facilitator, I shouldn't dominate the class. So you should be the one to actually interact with me and ask questions. I believe that you have gotten your course materials. I've also pasted it on the school page. So access it if you have not gotten one. And let me also say this, so that we can also interact outside this 1 hour session. I will need someone to open a WhatsApp group for this class, so that if you have any query or if you have any question or you want to clarify anything, you can post your question in the WhatsApp. Either me or any of you in the group can also address it. So I feel that will be important for us to do. So I will need a representative to assist us to do that. If you are willing to do that, you can send a chat, then I'll look at it. Then we can forward you the list of the class members with their phone numbers for them to be on the group. And so today's lesson is titled, like I've said, we will be addressing Unit 1, Unit 1. And in Unit 1, we have like four concepts that I want us to look at, that I want us to discuss together in this in the next few minutes. And I'm going to quickly share. I can see someone has dropped a message. I will look at it. So quickly, let me just share a slide. I won't be going slide by slide. It's a discussion. So we are going to talk to ourselves. I won't be reading a slide to us. So you've seen my name and you've seen my email. If you want to drop me an email, yeah, you're welcome to do that. That's my name. I've introduced myself as Dr. Lateef Adekweju. So let me quickly take you through the learning objectives or the learning goals for this course. So basically, at the end of this course, or at the end of today's facilitation, learners is expected to be able to explain health for all and the concept of health for all, define health, what is health, and not only that, to be able to list and explain the different dimensions of health as well as the determinants of health. Of course, you and I know or understand that a lot of things determines whether we are going to achieve good health or not. That is basically what we are also going to look at. And lastly, the prerequisites of health. So these are the 4 or 3 concepts that we'll be looking at in this few minutes that we have to interact together. That is the learning goal. And when we say learning goal, that is, you need to achieve this. That is, at the end of today's discussion, after this 1 hour, I haven't gone through the instructional video, and you can still go back to it because I've pasted it. You just click on the link on the school page, you will get it. So I'm assuming that learners have already studied concept of health in their basic nursing program. Yes, and that is where we are building, and that is why we are building on what you've already learned for better understanding and to help you develop a more knowledge and skills in promoting health. So I'm going to stop sharing my slide now and listen to the students or the learners on what they understand by health. Remember that I am to facilitate. This is not lecturing. And so for that reason, let me share, let me hear your thoughts. Let me hear from your thoughts what you understand by the concept of health. What comes to your mind when you hear the word health? What comes to your mind? Yeah. And remember that as much as attendance carries mark, your participation as well in class also carries mark. So endeavor to interact. So who wants to try? Who wants to open the floor for us on health? What do you understand by health? The concept, when you hear the word health, what comes to your mind?
There is absence of disease.
Okay, the absence of disease, good try. Yes, it's an absence of disease. Okay, anyone else to try? Anyone else to try? It's an absence of disease. So Naomi, is it that if I'm not admitted in the hospital as a result of malaria or typhoid or hypertension or diabetes, does that mean that I'm in good health? Is that what absence of disease really mean?
No, ma.
Okay.
According to WHO, it say health is a complete state of physical, mental, and then and complete as a complete state of health, not mainly the absence of disease or infirmity. Even though there is no disease or infirmity, does not mean that somebody is completely healthy. The mental aspect might be there also. One cannot be completely healthy now.
Okay. Thank you so much. I like that. But to say, anyway, let me hear other. Okay, Afa, let's hear your thoughts on that. Thank you, Naomi, for that brilliant contribution. Afa, I can see your electronic end up. You're welcome to speak. Yes, go ahead.
Yeah, my own contribution.
Can you be a bit louder so we can hear you?
Yeah, of course. My contribution here is hello?
Yeah, we can hear you. Go on.
Can you hear me?
Yes, loud and clear. We can.
Okay. So the concept of health, it has many definitions by different school of thoughts.
Okay.
So it has so many broad explanations.
Okay.
But the worldwide accepted definition of health is by World Health Organization.
Okay.
That describe as a state of complete physical, mental, and spiritual well-being.
Okay.
Not merely the absence of disease or infirmity.
Okay.
So in this definition, it encompasses a lot of things like physical well-being of an individual. Someone is physically fit, he can be able to, he has no any sign or symptoms physically.
Okay.
Mentally, he reached the expectation of the community. He can interact with anybody in the community.
Okay.
Without any problem.
Okay.
People are living with him in peace. He has to have a peace with others in the community and social well-being. That means somebody must adjust to the world expectation, to the world changes. You must adjust with the current things that is happening.
Okay.
If you cannot adjust with that, that means you are not healthy.
Okay.
So you must adjust with any changes that is happening in the community as an individual. So this is what I understand about health.
Okay, thank you very much. That was another brilliant contribution. I appreciate that contribution. And I like when you said adjust to the situation, especially in your society. I think you know what we are going to say next, because we're still going to discuss the determinant of health and the dimensions of health, where we will have to look at the environment of a person, how it's influenced. But do not let me jump too much. I can see Titus Peter. You're welcome to share your thoughts.
Thank you, Ma. Good afternoon, everyone.
Good afternoon.
Health is not a static state of being.
Okay. Okay.
it can change from low level of health, or let me say from sickness to being a complete state of health. It depends on the community where you're coming from. Some people believe in most communities, if you dress well, you smile, you laugh, you talk with people, people believe you are healthy. Not mindful of the other aspects, especially the economic, socio-economic, and psychological, spiritual, as the World Organization has put it right. So I believe with this teaching, we'll have more insight on how to incorporate all of them, so that when you said you are not healthy, despite your dressing, your appearance, people should be able to understand that you are totally sick and you need help. Thank you.
All right, thank you very much, Peter. That's nice that a lot of people actually, when you see them, you feel that by the side, especially we ladies, by the time we put up our makeup and dress in our nice outfits and we put all the powders, it hides what we are going through. And that's what you've just touched, that health is not static. You see someone today, tomorrow the person is on admission, or the person is home lying down, or the person is saying something that you cannot understand. So that tells us that really health has different, is on a continuum. Sure you understand? Yeah. So thank you all for that contribution for health and divination. And don't forget that the standard way of defining health is according to WHO, which you've all addressed or pointed out, that the mere fact that someone is not in the hospital or lying down on bed does not necessarily mean that the person is in good health. Thank you. So the next concept that I want us to look at is dimension of health. From your understanding, what are the dimensions? We basically have 4 dimensions. What are they? Who want to try?
Yes, ma'am.
All right.
We have social dimension,
Okay.
spiritual,
Okay.
environmental,
Okay.
and then apart from environmental, intellectual.
Okay.
Yes, ma'am.
All right. Thank you so much for that contribution. That's quite interesting that we have those dimensions based on the definition of health. So, and in addition to that, in addition to we having this dimension of the spiritual aspect, the social aspect, the physical aspect, the mental or the psychosocial aspect of that. One thing that I also want to add is that health has been evolving, and an individual has his biomedical concepts, the ecological concept, the psychosocial concept, and the holistic concept. So at what point can we say someone is at holistic concepts? So let's rub mind on that. Let's rub mind. Or what do you understand by biomedical? Yeah.
Yes, ma'am. Hello, ma'am. Can I speak?
Yes. Please go ahead.
Okay. Biomedical concept stresses on the germ theory.
Okay.
where a disease or the ill health is caused by microorganisms that we interact day and night with.
Okay. Yeah.
Yes.
And that is why we say that people, that healthcare worker should not see patient as a biomedical individual alone. You must be able, when you have a client or when you have a patient that you are relating or working with, you don't look at the persons as a biomedical alone. You look at the holistic aspect of the person. You look at what are other possible influence to the ill health the person is looking at. Like, for instance, there are people that when they don't have money, they get sick. They get sick. And permit me to say, I think that mostly affects our men, because men are the head. So when they don't have money to give to their wives or to give to their children or to perform their basic function at home, some of them are not well. I have a lot of men in this class. Is it true?
It's
Yes,
true,
ma.
man.
Yeah. So that we can say that the economic of the person is affecting or is challenging, let's put it, is challenging the person's health. Yes. And there are people that, because they are spiritual beings, we are all spiritual beings. If I'm not allowed to go to mosques to go and pray, or if I'm not allowed to go to church, for those of us that are Christian, then it begins to affect our well-being, because that has been part of you. So, and when you say ecology, what comes to your mind when you hear the word ecology? What comes to our mind when you hear the word ecology? Is that? Yeah, when we hear the word ecology, what comes to mind?
What comes to my mind about ecological concept is my ability to adapt to my environment
Excellent.
in order to live
Excellent.
healthy.
Excellent. Excellent. Yeah, it's basically the environment, because that has an impact on our health as well. And the psychosocial and the holistic, we understand from the word psychology, the psychosocial, and the holistic. And when we say something is holistic, what does that mean to you? What does holistic mean to you?
Holistic means incorporating biomedical, ecological, psychosocial, to be sure, following all of them as the World Health Organization put it, definitely one will remain relatively healthy.
Okay, yeah, that's why we said from the word whole. Now, this, in all these 4 dimensions that we have talked about, the person is balanced. So when one of these concepts, or when one of these dimensions is affected, then you can say the person is holistic, is having holistic health. So the next concept we will look at is the determinant of health. So I'm going to hear your view on those factors that can determine, or things that can determine our health. You're welcome to share your thoughts. What are those things? We can, from our experiences, even as in the video, you can share. What are the things that you know that determines our health? And don't forget, some of us come from a family history that has one background or underline this and that. Don't forget that the lifestyle, no, all those things. Let me not tell. So, Naomi, you want to try?
Yes, ma'am. We have an heredity.
Hereditary? Okay. Okay. Yeah, you are correct. That's our gene, the genetic, because we come from a family, mother and father. Okay. Who else wants to try?
We have lifestyle.
Lifestyle. Yes.
Yes, ma'am.
When you say
Yeah.
lifestyle, okay, continue.
Then we have environmental.
Environmental, yes. Yes. We have environmental, we have lifestyle, yes. What else?
Socioeconomic conditions.
Yes, socioeconomic condition. I hope those of us that we are mentioning this, we will be able to expatiate on it for us. You know, the more we involve ourselves in study in this class, the more it helps us, peradventure it comes out in a text or in an exam, because you involve, you'll be able to remember. So you are all right. So Naomi, you said hereditary. Can you share light on that point?
It refers to as a condition whereby a family member is being affected by one thing or the other that happens in the family. For example, if a pregnant woman is a diabetic mother, and then maybe during that delivery, after delivering, the baby may become obesity due to the high level sugar in the mother, and it may be affected by the fetus also after birth.
Yeah. Thank you. Yeah, that is right. That is right. That is right. Another thing is maybe you have the history that an individual's mother and the grandmother, maybe they had history of cancer. That's another thing. So the likelihood that the younger female in that family will also have cancer is 50-50, right? Because there is that history in the family. And the same thing with every other illnesses that we have in life. I could remember there was a time my mom was diagnosed of glaucoma. You know, I happened to be the person to follow her to see the consultant. And you know what the consultant said? He said, we have to screen all of you, as in all our children, myself inclusive, because now the consultant feel that if your mom has, there is high chances that one of you that she gave birth to will also have. So thank you so much. So you mentioned lifestyle. How will lifestyle influence or affect our health?
I am the one that mentioned it, ma'am.
All right, please, can you expatiate on it?
The kind of living condition one finds himself or herself definitely affects the attitude of that person. The social values surrounding that lifestyle will definitely make that person either sick or healthy. For instance, those who live, I know of a community where refuse disposal is poor. The habit in that community that you grow up and see people taking alcohol, smoking, and the rest of them, and you will turn up to live your lifestyle the way you see people living, thinking they are doing the right thing, and definitely it affects the health status of those inhabitants of that community.
Okay, thank you. That's true in one perspective. Another perspective that I also want us to look at is the aspect of what an individual practice. Take for instance now, if I'm a smoker, how does that affect my health, or what impact will that lifestyle have on my
Hello?
health? So
Yes.
those are
Hello?
the things. Hello?
Hello, I want to speak on smoking.
Okay, please go ahead.
If peradventure somebody or I find myself to be a chain smoker, there is likelihood that I may get cancer of the lungs.
Okay.
And then these respiratory tract infections like COPD, I'm likely to get that.
Okay.
Thank you.
All right. Thank you for your contribution and you're welcome to the class. Yeah, that is correct. And not only not only smoking alone. We can also apply it to every other habit that an individual can have. For instance, some has poor eating habits. I know some of my friends that they eat like every 1 hour. But you and I understand that whatever we take in takes certain time to process and digest. And so for someone who has an habit or a lifestyle of eating every 1 hour, the person might also have health challenge. Yes, because whatever you eat now, you are not giving it time. You are not giving the GIT time to work on it, to take what the body needs and expel what it doesn't need. So as one digestion is being interrupted and another one is being continued, so the one that is interrupted becomes toxic to the body. And you know what that does to our system. So there is not only that, some of us are addicted even to drinking. That's another lifestyle. Some are addicted even to drinking coffee. So these are lifestyle that if it persists, it can threaten our health. All right, so who mentioned
Environment.
environment? Yeah.
I'm doing,
Okay.
I'm doing, because somebody, for a person to live in a good and clear environment, it will help the individual health condition. For example, if a person is living in a different environment, like a company area where there is too much smoke from the company, and then environment will be polluted with this toxin that is coming out from the companies and industrial area.
Okay. Okay.
When pollution or air pollution also can cause detriment of the health of an individual.
Okay. All right. Thank you. You are right. You are right. So our environment also has a good influence. Did someone mention socioeconomic condition?
Yes, ma'am.
Okay. Let's.
Socioeconomic comes in socioeconomic, we'll put it as a major factor that help an individual to live healthy by one, when the person is not economically balanced, the person cannot be able to seek proper medical attention.
Okay.
When drugs are prescribed, the person cannot be able to purchase those drugs, and definitely the repercussion will be ill health and probably death. And the issue of educational status of an individual, again, those that are literate have health-seeking habit more. They are more informed to take certain decisions that they will live healthy and even teach their children or the community, thereby encouraging those people to be healthy. And the political system of a nation is also one of the major issues on socio-economic status of the political system. If the health system is good, you discover that the entire citizenry will benefit more from the health, and more techniques will be deployed where basic care will be rendered at all levels of healthcare system. and the occupation, those that are employed have better purchasing power as in form of economy than those that are not.
All
So
right,
they're
thank
different,
you.
I would say. Thank you, ma'am.
Yeah, thank you. Thank you for that explanation. That's a very good try.
Hello, can I speak more on psychosocial environment?
All right, please go ahead.
I want to say in a family where somebody is frustrated, you have a problem, you have been having problem with your family members. That person can't be healthy. Frustration can lead that person to an unhealthy life. Then in a workplace whereby you don't have that work satisfaction, whereby the manager is frustrating you, always giving you query, at a time that it will influence your health, because nobody feels healthy when you don't have mental, your mental status is unhealthy. That's my own. Thank you.
Thank you so much. That was a nice one. In fact, that was what I wanted to add to the point. I think Titus Peter contributed, because even as an individual, if you don't have money, it happens to me. Whenever I don't have, as in money, it affects me. You see me unnecessarily irritated. Nothing makes sense to me, because everyone wants to be buoyant. You understand? I also like the aspect of the job satisfaction that you also brought into the picture. That was a nice one. Yes, all these things affect, or one way or the other influence our health, whether we believe it or not. Whether we believe it or not. Like a friend of mine was telling me that, Yush, that like if he's achieving what he wants to do, and when he gets to his workplace, and his boss smiles and do not unnecessarily threaten his job, he sees that he's more productive and is more happier. And that's true. When you are working in an environment, or with people, or with an individual who believes in you, and who pays your salary as at when due, and who pays you what you deserve, you will be happy. Your health will be fine. You said?
No,
Are you saying something?
No. Sorry.
All right, if you are not contributing to class, you can mute so that you don't interfere with the class. All right, so that's it. So lastly, we've seen the determinant of health. We've seen that a lot of things actually determine whether we wish good health or not. And we said that our health is on a continuum. I'm not sure whether it was Peter that also said it, that health is not static. Today, you can be in good health, tomorrow, you can be on the other side. So we understand that. And so, lastly, the concept we want to look at is the prerequisites for health. What are the prerequisites for health? What are the prerequisites for health? One way or the other, we've mentioned it, but to be more specific now, what are the prerequisites for health? That is, what are the factors that affect the health of an individual and the community as a whole? Yeah, you're welcome to share.
Okay, in like sanitary, it affects the health of an individual. It's one of the prerequisites of health. Like the sanitary, if the disposal site is very, very conducive, there's no way a person can get infection.
Okay.
Then how the houses are situated. If it is in a overcrowded environment, there is tendency of transmission of infectious diseases.
Okay.
Then the water supply, another one is water supply. Water is one of the essential needs of person. Then you get air. You will just get all these things through the basic needs. Those basic needs, which is housing, good air, food. Then that is my own contribution.
All right.
That's the first.
Yeah, thank you for contributing. You are actually right. You are actually right. Before I had to eat, let me hear others' view on that. I can see Afa Abba.
Yes, ma'am.
Okay, you continue.
Yeah. In prerequisite of health, we have 3 different levels. We have at individual level, at environmental level, and societal level.
Okay.
So the medium or the one that is controlling all these activities is an individual.
Okay.
So the primary concern is on individual. So in individual, someone has to take care of himself, hygienic practices. He has to be clean his body. So he has to avoid all that unhealthy practices, drinking, overeating, or undereating, that drug abuse and others. And someone among the prerequisites of an individual, as is an individual himself, he has to what? To practice and exercise, a good sleep and rest, and others.
Okay.
So at the environmental level, an individual should always clean his surroundings and environment.
Okay.
So that it will not attract unwanted rodents and other things, bushes and other things that will attract diseases.
Okay.
Then the last aspect is at the level of the society. So someone needs to have a harmonious relationship between him and other members of the society.
Okay.
So if you want to stay a positive health, you have to adjust each and every individual surrounding you.
Okay. Okay.
So this is my own understanding in prerequisite of health.
Thank you so much for that contribution. I like that. You are actually right, because the whole prerequisite for health is narrowed or summarized into 3 that you just mentioned: the individual level, the environment, and the society. But class, not only, I'm asking a question now, not directed specifically to him, but to the class, and anyone can answer. He said that at environmental level, that one has to control his environment. But my question is, myself as an individual, yourself as an individual, is it everything in your environment that you can control?
No, ma.
Okay.
It's not everything.
Okay. So in situation where you cannot control, take for instance, noise, you want to sleep because he mentioned that individual level, that the person has to get a good rest, the person has to sleep well and everything. Maybe your house is situated where there is a company and they are using a powerful generator. What do you do in that condition?
You adapt to the situation. You use the adaptation method.
Yeah, you are right. You adapt. Otherwise, you will be having frustration. Instead of you coming home to sleep, you start getting frustrated, you start getting hungry, and you know what that is doing to your mental health. So adaptation. at every situation that we cannot control, especially okay, let me put it this way now. Between individual level, environmental level, and society level, which one do we have more control over?
Individual.
Society.
Okay, I can see two answers now. One person said individual, one person says society. Who has other opinion? Okay, Lawan Kadri, you're welcome. Share your thoughts. Let's hear you. Lawan, I can see your hand raised. Do you want to respond to the question that I asked? If you're able to hear us, go ahead and share your contribution on that. But the person that said individual, why do you say it's individual?
Thank you, ma. I mentioned individual because as the law of living says, whatever good you want from others, you should be able to do that good.
Okay.
For instance, if I am in a neighborhood where I don't want noise to happen, I should be able to control noise around to reduce noise around my environment so that it will not interrupt with my neighbors.
Okay.
But peradventure, I'm a victim. Anytime they make loud noise, I cannot say a word because I am a victim.
Okay.
Something happened somewhere. Someone was using generator to disturb the neighbors, and the neighbor decided to go and bought Lister generator, which is bigger than the small generator that person was using. And he pointed the exhaust toward that person's window. So you will start your small gen, and the other person will start his own Lister, and the whole trouble, everything is scattered. So as a peaceful being, as I live peaceful with my neighbors, definitely my neighbors will live peaceful with me. I will adapt to each other and life will be better. And if all of us do that, at the level of the community will be good and the society will definitely be good. That is my resistance.
Okay, I'll give my final comment after I hear from everyone. Lawan Kadri, are you
Yes,
ready
ma'am.
to speak? Okay, go ahead.
Good afternoon, everybody. I'm just trying to join the conversation now.
You're welcome.
I think looking at the individual situation, if each and everybody can be a kind of following the orientation of controlling the noise in their environment, I think the environment will be a good place for each and every one of us.
Okay. All right. Thank you, Lawan, for that contribution. It's appreciated. Naomi, I can see your hand up. Let's hear your thoughts.
Yes, ma'am. Still talking on the individual level, because individual level has to do with each person's the way, because that has to do with hygiene practice and then cleaning of the environment, wearing of footwear. So that one can be able to be in control of the individual level than the other two levels being mentioned, because the individual level has to deal with how you take care of yourself, how you take care of your clothing, your drugs, how you sleep well. There is nobody that will have to come and take care of that for you. So that is easily controllable.
Okay. All right. Thank you. I can see Ioma. Ioma, your hand is raised. Let's hear your thoughts.
So, yes, I want to draw my own on environmental level, social environmental level, because one cannot be healthy even if you eat a very healthy food from individual level and you are not in harmony with your neighbor or even your family member, I'm telling you that food will not digest. So you will not have you have indigestion. So and which may lead to stress that can cause peptic ulcer. So it is better you live in a very harmonious environment with your neighbor and even your children or your wife, with your husband, so that the individual level can be met. Thank you.
Okay, thank you so much. You can raise your hand. You know, if you ask for my stand, I will say an individual. And this is my reason. Mm. You see, as an individual, because it is an individual that makes a family, it is the family that makes the society, and it is the family that lives in an environment. Different families live in environment. And so for me, if my any of the family is not talking to me, I can choose to be at peace with the person, to greet the person, to talk to the person, to be nice to the person, irrespective of the person's disposition towards me. And it makes my life at peace. You get? But for the society, there are a lot of things that you cannot control. You cannot force someone who do not want to greet you to greet you. You cannot force your boss or your manager at work to be nice to you. But you can choose to be nice to your manager. You can choose to perform your role and your duty as at when due. You get? So for me, the individual has more influence to promote health greater than the environment and the society, even though they also have their role. Because if I'm living in an environment that is polluted, I can devise means to protect myself. But if I am not in control of myself, then the environment and the society will be controlling me, and that will be disastrous to my health. So, yeah, thank you all for that contribution. So, in some way now, for prerequisite for health, we have 3 prerequisites for health. And we mentioned, just as Afad mentioned, that we have individual level, the environment level, and the society level. So in case you come across the question anyway, just understand that 3. And that 3 can be broken down further. So, but just know that it comes in 3 categories. So understand that we have 3 more minutes to go. Before I draw the conclusion, do you have questions? Do you have contribution, additional contribution? Okay. So I want to ask for a day outside of these Thursdays that we'll be meeting to catch up with what we missed last, because what we missed last week is actually what we are doing today. So we need 1 extra class. So please be thinking around it, and I will ask for your contribution next Thursday so that we can agree on which day. It can be any time. So we have to agree so that we'll meet and catch up with 1 class that we couldn't hold that last week. So I must say that you have been very interesting, this class to me. And it's interesting because you all contributed and you log in on time. Please, let's keep this spirit up for the next 8 hours. So for now, this is where we'll end it. Okay, maybe before I end, let me draw a conclusion of what we have said. So in this unit so far, is some way now. In this unit, we have discussed the following: the concept of health, which traditionally means the absence of disease, the definition of health by WHO, which states health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. We've also discussed the relative concept of health, that is, we cannot set international standard of health, and the health of an individual varies from culture to culture and from country to country. And based on that, we've explained the dimensions of health. We've also learned about the determinant of health, as well as the prerequisite of health, and the importance of hygienic practices, good environmental condition and social being. Thank you all for attending to this class. I really appreciate you. I will see you same time next Thursday. God bless.
I want to say something.
Thank you.
Okay.
so much.
Go ahead.
There was the issue of that group. You said that
Yes.
someone should open.
Okay.
So maybe I can suggest that you can appoint someone there to open the group for us.
Yes, because remember, this is a distance learning. It's not like a physical class where I know all the students. So what I can do is to ask for a volunteer. For me, anyone can volunteer to create a group. Then I'll send the person's my own contact number to add me to be part of the group. So who wants to volunteer?
I think I can do that.
Okay. Please, your name.
Lawal Quadri.
Okay, Lawal Quadri. Okay.
Yeah.
Lawal Quadri. Okay. So I'm just gonna put my
Let me
number.
try and call my phone number.
Okay. No, since you are the one that is creating it, you are the class representative, you are the admin. So what I'm just going to do is on the chat now is my number.
Okay.
So you can just add me to the group.
Okay.
Remember to put it the way I put it. It's not a Nigerian number. So you can add me to the group. It's +27 +27 63
Okay.
63 21.
21.
Yeah, look at it on the chat because this is being recorded. So you look at it on the chat. Can you see the chat? Just go to the chat and check. I've put it on the chat.
Okay. I will add you.
Okay. All right. So everyone also should send their number. I think you need to send us your number so that everyone.
Yeah, that's why I wanted to call the number.
Okay. All right. You can send it on the chat. Just type it on the chat and send it.
Okay.
Everyone will see it. Then they can copy it.
Okay.
For security reason, let's not dictate it. Yeah.
Okay.
Okay. So we are still waiting.
081. But for those that can grab it there.
Just type it. Just type it. I can see Peter sending
Somebody,
it. Just type yours. Go to chats. Then type your number and your name. Then press enter. We will all see it. As many of us that are in class, we see it. Are you winning with that? So just go to chat where you will see chats. Then you type it. Then press enter. Then we will all see it. I can see others sending theirs. We are still waiting for our admin to send it so we can make it. Lawan, are you winning? Are you winning?
Yeah.
I can see Naomi, I can see Yaya, I can see Lomo and so on. Alima, yeah, I can see yours. All right, it's fine. If you are still struggling with that, Lawan, have you copied mine? Have you copied my own contacts?
I'm working on that.
Who is close
Just
to you?
go to where Mon is. Mon, you press it. Maybe it's finding it difficult. Go to the
setting I'm trying to do.
You said what?
Go to the extreme now. and
be
type where you see more.
let's be patient with him.
I've already clicked more. It's for me to now see the
Chat. You
latest.
see chat. You see where chat is. Then
I've already clicked on that.
Yeah, you see
type
where they
now.
wrote type message here. So
Type now. You see type here to chat. You will see it or message to reply. Just type inside that box.
Are you winning with that? Okay, Lawan, let's do this. Let's do this. Did you manage to get my own number?
No.
You didn't get my number. I put it on the chat.
See, send to everywhere. You will see that more. When you press more, you will see send to everyone. Then you click on that box there and type in your name. Have you done that?
Or better still, he can do screenshot and add the number later. I don't know.
You know what we wanted to remember, we are all learning. Don't worry, don't give up.
Okay.
Just don't quit.
Oh yeah, call your number now. Call your number. We can chat you. Call your number.
01
47
47
47
Zero what? Zero what?
81
Okay.
47
Okay.
32
Okay.
32
47.
what? 32 what?
37 36
37
47 36
Okay.
36
24
47.
Okay. 24.
I'm lost,
15.
so please.
No, I'm lost.
Don't worry.
081.
Let's take it. Please, let's take it easy. We will repeat it. 081 47 36 24.
36 15.
Okay, 15. So I'm putting it on the chat, and I'm putting his name. Lawan Patrick. Yeah. So I've posted it. That's his number. So you can chat him.
36
Yeah.
15 081 47 36 24 15.
Are we correct?
And his name?
His name is there. His name is
Lawan.
All right, thank you.
All right. Thank you all for your patience. I really appreciate. Hopefully, we'll get this WhatsApp group in the course of the week. Then we can keep in touch before our next class. So I'm gonna post this live session. I'll post the link on our school page. If you want to listen to what we discuss or you want to share with any of the class member, you're welcome to do that. And every week, how many of us received the email I sent? I hope we all did.
I didn't though.
I
didn't. Though I didn't check any email.
So you need to check your email because usually a day two or on the day of our class, I will send an email to remind
I saw the mail.
Oh, thank you.
I didn't see my mail, Shaki.
So I will always send to remind us because I know some of us are busy with so many things. So we'll see ourselves next week, same time, same day. God bless.
Thank you, ma.
Thank you, ma. God bless you too.
Bless you.
Thank you, ma. God bless you, ma.
Bye.
Thank you, ma.